There are things we can all do to decrease our cancer risk. New research is showing there is a scientific connection between our behavior and that terrible disease.
Specifically, how nearly half of all cancer deaths in this country are linked to the unhealthy choices that we make. We wanted to get some perspective on this from our medical expert, Dr. Mandira Mehra from SSM Health. Good morning. Good to see you.
Good morning. Good to see you.
So we have known for years smoking causes issues, overeating causes issues, excessive alcohol consumption causes issues. Now we know they're directly tied to cancer. Why, from a macro level, is this so important to have kind of nearly half of all cancer deaths related to our choices? Why should we be talking about this?
I mean, that's a great question, Adam. So we all fear certain health consequences, whether it's a heart attack, whether it's the big C, the cancer. And so many times things happen to us in life that are kind of beyond our control, so to speak. You know, it's kind of the cards we're dealt, the genetics we're born with. But to say that nearly half of all cancers are preventable, or maybe it was in our control, is a huge number, both on the individual level as well as on a public health kind of crisis level. And so just like you said, we talk about smoking all the time being so bad for us. So when we look at this study, it studied things like what amount of smokers developed lung cancer or vice versa. And so to think that that was a modifiable risk factor, something that we control, something that maybe we caused upon ourselves, is something that we should really stop and say, you know, what else can we do to stop people from doing this? And so the three things that they really looked at were things like smoking, obesity, and of course alcohol consumption. The smoking, of course, was linked to things like lung cancer. The obesity was linked to things like liver cancers, breast cancers, and of course heart disease. And the drinking was linked to breast cancer, uterine cancer, as well as liver cancer.
Serious. It's just fascinating to me, because it's this question of personal responsibility versus the public good. I mean, if I know that smoking's bad for me, why can't I go ahead and do something like
Exactly,
this?
and so part of it really comes down to educating the public. Like you said, so many of us know, I mean, everyone's got to know by this point that labels are right on the cigarette carton, that this is bad for your health, and in so many ways. It's the cancer way, the breathing, the secondhand smoke, etc. But now we're able to say, close to 50% of deaths are preventable, maybe because of modifiable risk factors like staying out of the sun, eating healthy, exercise, don't smoke. So again, you can do all these things right and still develop cancer. I don't want anyone to think, you know, based off this study, if you do everything right, you'll never develop cancer. But maybe 50% of those people would not be developing cancers or dying from them.
Switching gears quite dramatically is a study that I'm very excited about, which shows that owning a dog, owning a pet, can actually help us live longer. This is great.
It's kind of related. We talk about modifiable risk factors, right? So
grab a dog.
I think we've known for a long time that those four-legged friends of ours can definitely improve our mood. I mean, pretty much right away, they make us happy and joyful and maybe in a playful mood. I myself am a huge dog advocate. But this
Amen, sister.
This is a great study. It looked at over 30 million people over 12 years. And this showed between the ages of 40 and 80, having a furry friend may actually save your life. So it looked at people that were single, meaning not necessarily part of a family with children, that did have a dog. And those people exercised more, their cortisol levels were lower, they had lower triglyceride levels, overall also had better social interaction. And so we talk about what are those things that we can do to live longer, and it's all of those things: better social interaction, better immune system, really improving the mood, lowering those cortisol levels. We talk about cortisol levels, that's really just your stress hormone. So we all will get stressed during the day. We all will get stressed during the year. The holidays are coming up. But maybe having this four-legged friend brings down that overall stress.
It's a massive study, too.
It's massive. We're not talking about 100 people over a few months. We're talking 30 million, close to 3.4 million people over 12 years. Really extensive study. The next study really needs to be, why is that owning the dog really improved your health? Is it that intrinsically people that have a good heart, better cardiovascular health, were tended to have dogs? Or is it the other way around, that people with dogs did these modifiable risk factors? They exercised more, the cortisol levels came down, and so that's going to be the next thing. Is it cause and effect? Is it chicken egg, or is it the other way around?
Fascinating. 6
of them up for adoption over at Dane County Humane Society. Just logged on. Just saying.
Dr. Mehra, good to see you.
Nice to see you.
Thank you.